We all know that GvHD is really a major and serious complication after allogenic stem cell transplantation. And actually, until now, we do not have any approved second-line therapy in those patients with steroid refractory acute GvHD. The exciting news these days is that we have many ongoing phase 3 trials, and during this annual American Society of Hematology 2018 meeting held here in San Diego, we will see the presentation about results using ruxolitinib in this situation. And actually, these results are very interesting with a relatively high level of responses. However, we need to look carefully into the final data, the detailed data. Maybe some of these patients were not 100% refractory or very advanced, so this is one aspect, but definitely the results are promising. The other aspect is related obviously to the safety of using ruxolitinib, especially when it comes to infectious complications. But on the other hand, we need to acknowledge that these are patients who are heavily immunosuppressed. Therefore, you would expect a lot of opportunistic infections. So clearly, ruxolitinib, based on the presentation made here at ASH by Dr. Jagasia, looks very promising. But there are also other tools that are being developed, and in this meeting we've seen more and more data presented about the role of the microbiome, and actually trying to restore or to correct the microbiome, and a pathological microbiome is called dysbiosis. So trying to tackle this dysbiosis is extremely important. And we know that there is an ongoing European trial called Heracles, testing the use of fecal microbiota transfer in patients who suffer from truly steroid refractory acute GvHD. And according to the first information we have, actually it looks like to be very promising with an excellent safety profile. So in summary, while we've been waiting for 30 years to have an effective therapy for these acute GvHD patients, actually now the field is moving rapidly, and we may end up having many different options available very soon. So that's very exciting. That's a lot of hope to all of us, because we all know that allogenic stem cell transplantation is the only curative therapy for many hematologic malignancies, and we really need to try to get rid and control this serious complication of acute GvHD. And I believe we are on the right track.